The link to the webinar will be available on the Kvinna website in a couple of weeks, and we will let you know when it's posted, as well as all the resources that I've already shared with you via email and in the invitation. Please use the Q&A icon to write your question. So we would prefer that the questions will be asked in the Q&A box at the bottom of the screen instead of the chat box. Yeah, so let's start. Welcome everyone, first of all, and we are very, very happy to see you again, and I hope you will enjoy this very interesting webinar, especially if you are working on feminist issues, care economy, economics, and we have the pleasure today to have with us speakers from the Global Alliance for Tax Justice, represented by Carodino team, and Kvinna Rodriguez-Enriquez, who is working for DAWN, right? Or yes, which is a organization, South American organization, as well as Veronica. I will introduce them later in details. And then we have Aziza Khalidi from Lebanon, who will talk to us about care work in the MENA region. So the object of this webinar is to explain the concepts of care and tax justice, because as we all know, women are economically disadvantaged because they perform up to 75% of all unpaid domestic and care work, in addition to any paid work they may be able to perform. So to overcome this, we must move towards a care economy that values care and human welfare over profit maximization for a small elite. This session will focus on what we do mean by care economy. How can we change economic structures to recognize, reward, reduce, redistribute, reclaim, or what is called more commonly the 5 R's, women's domestic and care work. And we will ask the questions, what are the options for measuring care work, and can it be reflected in GDP to become part of the official economy? What are progressive, regressive, and pink taxes, and how can tax systems be structured to provide fiscal space for social services that can reduce women's unpaid work? Introducing examples for concrete tax reforms that can be championed to generate fiscal space for social service, and why this may be difficult to introduce. The session will also provide examples from other countries of successful campaigns for more gender responsive tax reforms and how to organize towards it. So we will start with a presentation from the Global Alliance for Tax Justice, and then a presentation from DAWN and PSI, and we will move to CFTDA, and then we will open the floor for questions and answers for the audience, and then we will wrap up. The webinar will last an hour and a half, and I will start by introducing our speakers, who will also have the chance later to introduce themselves and their organizations. I will start with Caroline. Caroline team is the Global Policy, Advocacy, and Campaigns Coordinator with the Global Alliance for Tax Justice. She is a Pan-African feminist economist and a gender specialist. She is the thematic lead on tax and gender at the Global Alliance for Tax Justice, leading the global campaign on Make Taxes Work for Women. And I hope you have all watched the video that they have produced on the matter, which addresses the centrality of care in the economic system. She is passionate about tax and gender justice and works in policy and advocacy spaces to ensure that tax justice is a lived reality for all, particularly for women and girls everywhere. Prior to joining Global Alliance for Tax Justice, she worked and consulted For UNICEF Kenya, Open Government Partnership, East Africa Tax and Governance Network, Women in Law and Development, and the Kenya National Taxpayers Association. Then we will move to Veronica Montufar. Veronica is a sociologist and political scientist with a master's degree on political sociology. She works in Public Services International, or PSI, as an equalities officer. She is a gender history researcher and human rights, and she worked on human rights as the executive secretary of Amnesty International in Ecuador. She also worked at, she is also a member of the Trade Union of Ecuador at the Ecuadorian National Trade Union Center. She started working for PSI in 2022 as a project coordinator for the Andean region in the field of educating and organizing women. Since 2015, she was appointed as a gender officer, and in 2019, she became the equalities officer. Corina now. Corina Rodriguez Enriquez is an economist from the University of Buenos Aires. She holds a master's degree on public policy from the Institute of Social Studies, The Hague in the Netherlands, and she holds a PhD on social sciences from Flaxo in Argentina. She is a researcher for the National Council of Research at the Interdisciplinary Center for the Study of Public Policy in Buenos Aires. She is a co-director of the PhD program on political economy and Interdisciplinary School of Social Studies. She's also professor at national universities in Argentina, consultant for international agencies. She works from the feminist economics approach in issues on social and fiscal policies, corporate capture, inequality, and care economy. And then last but not least, Dr. Aziza Khalidi. She is a member of the management team of the CRTDA and an activist, researcher, and academician. She's a member of FemPower Steering Committee, and the FemPower, as you know, is this project that we are leading at the Kvinna Foundation on feminist economics and economic gender-based violence. And Aziza has around 10 years of experience of work as a field researcher in GBV in refugee settings in Lebanon, as well as program evaluation, and currently working in a CRTDA community-based projects on economic gender-based violence at the community level. I will now ask Caroline if she can kindly start introducing us to the concepts of care and tax justice. And if you can also introduce further CFT, Global Alliance for Tax Justice.
All right. Thank you so much, Sama. Thank you for inviting me to this webinar. I'm excited to have this conversation and to be in this panel with such a stellar lineup of speakers. To start with, as Sama has mentioned, I'm Caroline Othim, and I'm with the Global Alliance for Tax Justice. The Global Alliance for Tax Justice is a global coalition of regional tax justice networks in Africa, Asia, Latin America, Europe, and North America. And collectively, the Global Alliance represents hundreds of organizations drawn from the civil society, drawn from academia, researchers, academics, and as well as the global trade unions. And together we work towards pushing for a more democratic space for the reform of the international financial architecture and for tax justice to be a lived reality for all. I also want to mention that I double up as the co-chair of our working group on tax and gender. And the working group provides a space for its members and partners to engage on the campaign and policy work on issues of tax and gender, so including issues on care. including issues on gender equality. And this serves to strengthen our global integration. And the working group is really a powerful collective of women's rights organizations and the tax justice movement, who together we are advocating for social economic change. It really is a very vibrant platform which representatives from all over the world share good practice, expertise, advocacy strategies, and build each other's capacity. And one of our main objectives is to advocate for the adoption of gender equal tax systems where tax and fiscal policies recognize and, of course, also redistribute women's unpaid care work and promote economic and gender equality through progressive taxation. So if you're interested, of course, to join the working group, please do let me know, or you can get in touch with Sama, and she will be able to put you in touch with us. Together with me on the call are two of my colleagues who will also be speaking later, Veronica from PSI and Kvinna. Together, we are part of a loose network that have started conversations around the rebuilding the social organization of care and championing this particular cause. There's a manifesto that has been developed, and of course, we will be able to share that, and I hope Sama also shared it with the resources list before. So basically, this loose network of feminist economics, the social movements, argue that one of the pathways, one of the solution out of some of the intersecting inequalities that we are currently experiencing really is to change the way care is perceived, and to be seen more as a public good, and to realize and guarantee the human right to care. And of course, this is through the 5 R's framework. I'll not really get into so much at this point, but I know Kvinna and Veronica will reducing, redistributing, and reclaiming care and domestic work. So for my presentation, I would want to focus on 2 questions. Number 1, why should we really care about care work? And the other question that I'd also want to expound on is on why we need tax justice for care. So those are the 2 questions that I'm going to look into. And to begin with answering the first question on why we should care about care work. We, of course, know how the pandemic has really illustrated the need for adequate investment in universal, equitable, quality, public, and gender transformative health and care systems, because care is a very critical public good without which our societies would not function, without which our economies would not function. And as has been said before, it can be paid or unpaid care. Unpaid care, of course, has no explicit financial compensation, while paid care, of course, has a remuneration attached to it, or is usually in kind. And most of the time, it is usually underpaid care. So I think we really need to get note of that. When at times when care is paid for, it is usually underpaid. And we should also really care about care work, because unpaid and paid care work really is at the center of gendered inequality. For care work continues to perpetuate gender and economic inequalities. And it also continues to undermine women's health and well-being, while of course enabling men's dominance in business and in politics as well. And so this is why we argue for the need to rebuild the social organization of care, recognizing the right to receive care and responsibility to care for the people and the planet. But the way we see the current economic system, it is built on patriarchy, it is built on capitalism, And unpaid and paid care work is also predominantly being done by women, especially those who are living in poverty and from groups that experience intersecting discriminations based on either gender, sex, race, etc., etc. And so with the pandemic, it continues to really highlight the centrality of care, while on the other hand, exposing the weaknesses of our social and economic policies that have chronically undervalued and underinvested in women's labor, be it paid or unpaid, for decades and decades. And of course, in some countries, the pandemic is also intensifying these inequalities that I'm talking about in care provision of communities who before the pandemic really also struggled to integrate their work and family responsibilities, talking about migrant workers, talking about domestic workers. So really, it's important for states, for governments to look into the issue of care. And how can states do this? Of course, through ensuring that care policies are in place. And because care policies are very critical to address this gender division of labor that I'm talking about. And this would go a long way to support the fulfillment of women's rights. According to a UN report of 2016, it noted that care policies are important because these are public policies, including tax and fiscal policies, that allocate resources, services, or time to caregivers or people who are in need of care. So incorporating care into the national public policy agenda really is very important and goes a long way to encompass the 5 R's framework to care, which I mentioned at the beginning. And of course, together with progressive and fair taxation, gender-responsive monetary policies and just care policies will enable us to achieve a feminist future that cares for people, for justice, and for rights. And so this brings me to the next question around why do we need tax justice for care? Now, to achieve a caring economy, we really need a shift in our fiscal policies, okay? And tax justice is the state where everybody is able to pay their fair share of taxes according to their ability. And so when we are able to shift our fiscal policies towards prioritizing the well-being and equality, particularly gender equality over growth, over economic growth, then really we will get to that point of having a more caring economy. And so this means that states need to raise revenue in a way that is transformative and in a way that also seeks to invest in care policies and in care service provision that is adequate and that is quality. And this means that states also need to restructure the tax systems to move away from the regressive reliance on regressive consumption taxes that continue to really entrench gender, economic and care inequalities, which of course continues to place an undue burden on those who are least able to pay and move on be able to afford to pay. So governments relying on regressive taxes such as VAT continues to penalize carers, particularly women and those who live in poverty, because they're the ones who are most likely to be responsible for family budgets and reliant on consumption of goods and in part-time employment, and therefore they pay a fraction of their makes those disproportionately responsible for providing care to be less able to afford care when these care services are privatized or, involved paying a user fee for you to be able to access. Instead, states really need to focus more on taxing wealth, on taxing top incomes, and on closing the loopholes from multinational corporations so that they are not able to use secrecy jurisdictions to stash away cash and for illicit financial flows. We note that from an Oxfam report that taxing an additional 0.5% of the wealth of the top 1 richest people over the next 10 years would be equal to investments needed to create around 117 million jobs in education, in health, and elderly care, as well as in other sectors. And this can be used to close the deficits that we are seeing. And so it's important for states to really prioritize stopping tax avoidance, stopping tax evasion. And this, of course, would go a long way to plugging the huge gaps that we are seeing in the provision of gender responsive public services. So I would want to stop there and hand it back to Sama. And if there are any questions, I'd be happy to take those. Thank you so much.
Thank you so much, Caroline. There are no questions so far from the audience, so maybe we can carry on with the other presentations and then open the floor for questions at the end. Veronica, do you want to go ahead right now? Thank you.
Thank you very much, Sama, and greetings, everyone. It's a real pleasure being here. Greetings on behalf of Public Services International. We are the Global Union Federation that represents 30 million workers in the public services, among those social care workers, of which the majority are women workers. So we are proud to be also the face of women workers around the world. Yes, I am, as you already said, I am a trade union educator. And as a trade union educator, I really like to show figures and to show things while I am talking. So I will be doing a presentation. So I hope I can share my screen. Please let me know if you see it. Yeah? Okay.
We see it now. Thank you.
Thank you, thank you. And I also want to say that Public Services International is also a member of the Global Alliance for Tax Justice, and we also are part of the Tax and Gender Working Group. So we work really together with Kvinna, with Caroline, and with all our sisters on the Tax and Gender Working Group. Okay, so we as Public Services International, as PSI, really were shocked about the COVID-19 and the multiple crises that the COVID showed us. And we really saw that the health crisis also involve an economic crisis, but the health and the economic crisis also involve the care crisis. So these multiple crises had at the center women's labor and women workers. So that's why we were shocked and say we have to respond. And we have to respond not only in the way of protecting our members, but also trying to go forward and trying to really encourage and challenge the current situation. So in that aim, we really saw what was this care crisis. And we saw that the care crisis show us also multiple relations between the economy, between the political level and also the cultural level, but also the relationship between the economy, the politics, the cultural level with the global level. And we start saying, yes, in the economic level in which we see the care economy, we see the unpaid and undervalued work, especially of women. But also we see here how care has become a part of the extraction market, and how care also is adding value for the privatization issues. And we said, yes, the care economy is important to think, but we need to shift, not only seeing the care economy, not only seeing this part that is important, but it's not the total part of what the care crisis is. And we saw also the care policies, and in the care policies, we saw an absent state. In many of our countries, the state was incapable of thinking care as a public good, as already Caroline said, but also they were thinking social care as a minimum social assistance, not as the main responsibility of states. So the politics of care was really undermined. But also we were seeing that there is some kind of ethics of care. And this ethics of care really put the burden of care in women, making care work as natural for women. And we say this ethics of care is also part of the crisis, because we are seeing women as the major responsible of this work, and as a natural responsible of this work. And also we saw that this was all connected with the care, the global care chains, and how migrant care workers were also undervalued, but were also putting their lives and their lives to this care crisis. So that's why the World Women's Committee, PSI World Women's Committee in 2020 called on PSI to develop a more radical thinking on care. And then we have this political decision to move from the care economy, move from this vision of the care economy that for us is really restrictive, to this other more holistic vision, more holistic concept of the social organization of care. And doing that, we call to a number of feminist organizations worldwide, trade unions, human rights organizations, and tax justice organizations. And we jointly released this care manifesto on rebuilding the social organization of care. And what is the key issue of this care manifesto? This care manifesto is calling to craft a global movement in support of this need of rebuilding the social organization of care. And we present to the world these 5 R's. We have been seeing that, especially partially, 3 R's, they are almost like a global agreement on 3 R's. The recognition of the economic value of unpaid care work, the need to redistribute care work between the household members, but also the need to reduce the burden of unpaid care work from women. But we think that we are proposing also to the world 2 other R's and 1 other part of the recognized R that we think that is key. In the recognized R, we are proposing to, yes, recognize the economic value of unpaid care work and how unpaid care work sustain the world and sustain the capitalistic system. But also we are proposing that we need to move also to the recognition of the human right to care, because only the recognition of the human right to care will put in the center of the responsibility to the state. We are also proposing that we need to reward care workers, and we need to reward the paid care work that is undervalued as well, because it's a work that has been undermined their social contribution to society. And this reward needs to be linked to the ILO decent work agenda, where the ILO decent work agenda really highlight the issue of full employment in the care sector. And this full employment also needs to be formalized employed. And this formalized employed also needs to integrate migrant care workers. The other part of the decent work agenda is social protection. And we are seeing that this social protection needs to be gender transformative, because we see that social protection systems also penalize women as women workers. And we are also saying that it's key to really recognize and respect workers' rights, but especially collective rights. And those collective rights that really are the base for conquering the other rights, such as freedom of association, such as collective bargaining, and such as social dialogue. But also we said that it's important to have social dialogue, and in that social dialogue, we need to reinforce the representation of care workers and the representation of women care workers in the discussions of the care sector. So this manifesto was launched in the context of the United Nations CSW, the Commission on the Status of Women, on its session 65 this year in March. And the organizations that released that manifesto were done. The organization from which Kvinna is, ActionAid, the Center for Economic and Social Rights, the Global Alliance for Tax Justice, and Womankind. And the manifesto until today has 417 signatures in total worldwide. And now we have 2 other members part of this core group of rebuilding the social organization of care. And these are the Global Initiative for Economic, Social, and Cultural Rights, and PEMNET. How do we think the way forward on rebuilding the social organization of care? One of the major things that we have been doing is like searching for evidence on how the social organization is, how is the current social organization on care. Kvinna will be speaking more on that. But I only want to put our work in perspective. And what we really want at this moment, when we have somehow some evidence, some empirical, but also some conceptual evidence to move forward, we want to focus right now in the UN system and how to really make make real the recognition of the human right to care. So we are working on that. We will be presenting some ideas in the context of the 10th of December this year, the International Human Rights Day. But also we think that we need to build movement. And building the movement is one of the key issues that we need, because we need to press, we need to influence local, national, and global governance, because we need these changes to go on. So I leave it there. Thank you very much, Saman.
Thank you very much, Veronica. We will eventually dig deeper into examples later, but for now, Corina, the floor is yours.
Thank you very much. Thanks for the invitation to be in this conversation. I'm very happy to be here and to share this panel with the colleagues who are comrades from many battles. I will build upon what Veronica and Caroline have already said. And I think it's very key how you frame this conversation, getting together care and tax justice. And I think what mainly links these two issues is the worry about inequality, because care and the way care is socially organized today, as well as how governments collect resources to support their public policies. These are two issues that are key to understand how inequality is reproduced. So I think it's very important to have this conversation being articulated and going together. As my colleagues have already said, when we think about care, we refer to all that is needed for everyday reproduction. It has to do with direct care. It has also to do with labor, the work of caring for people. It has to do also with the management of care. Sometimes we don't necessarily do direct care, but we organize care arrangements. It has to do with the resources we need to access care provisioning. And a concept that has been extensively used was this of care economy. Both Caroline and Veronica and also Sama mentioned this. And I think the care economy concept, as they have said, has been very powerful to visibilize the systemic economic role of care work. And in fact, in some countries, there have been efforts to estimate this contribution that care works do to economic value. So building on time use surveys and summing up how many hours people allocate to unpaid care work, and giving this amount of time some value, some economic monetary value, then in some countries they have come up with this estimation that unpaid care work contribute more or less. It depends on the countries, it depends on the methodology they use to do this estimation, but more or less unpaid care work contribute to between 15 and more than 20% of the GDP. In many countries, this means that unpaid care work is the main economic sector. In many countries, there is no other economic sector that contributes 20% of the GDP. So this is very powerful to show the relevance of care work, and really to support our message that care work is key to support not only everyday life, but also to support the economic and social system. And this work needs to be recognized also because the unequal division of this work, the sexual, social, international division of work, implies that women, and mostly poor and racialized women, are those who take the heavier burden of unpaid care work. So in the way that when we talk about care economy, we are not only referring to the contribution of unpaid care work to the economy, but also how in the way of care arrangement, we can find the basis for women's economic subordination, because the heavy burden of care prevent them to participate in the labor market, to work longer hours, to go for better jobs. But as Veronica already said, this care economy concept also has restrictions, and I would say that it also became a bit risky because it has also been, in a way, taken from some perspective that want to emphasize the care sector as an economic sector. And this is also a risky platform for thinking about care as a business opportunity, no? And to bring the private sector in the provision of care, and then to go for care as a commodity that can be sell and buy. And this is, from our perspective, really risky, and that is why we're supporting this idea of shifting from the concept of care economy that, as I said, have been really powerful to visualize and to make many relevant points, to this notion of social organization of care. And what do we mean by social organization of care? We refer to the way care is provided not only by unpaid care work, but also through public provisioning, through public policies, through public care services, but also through the market, private provision of care. When we hire someone to do domestic work at our household, at our home, or we pay to someone for caring for our children, we are buying care. We are going to the market to buy care. And when we have to pay to access health care, for example, we are buying health care in the market. But also in many countries, there is a fourth actor in the social organization of care, which is the community. Community-based arrangements are very relevant in rural areas, are very relevant in some neighborhoods. So when we think about social organization of care, we refer to the way that in an articulated manner, households, the state, the market, and the community provide care. And what we see in the evidence, Veronica was saying that I was part of a research that we have been doing with the support of PSI, to see how this really, what is the shape of the social organization of care in different countries. And something that we see everywhere are these 4 or 5 general characteristics of the social organization of care. One is the high burden of unpaid care work on women's shoulders. Everywhere, with differences between countries, women still do most of the unpaid care work. And this, of course, is a main barrier to women's economic autonomy. The second general characteristic of the social organization of care is that paid care work is very feminized. Mostly paid care workers are women, and in many cases, paid care workers are also migrant women and racialized women. And I think all these things, that workers are women, are migrant, are racialized, has to do with the precariousness of paid care work. Paid care work, as Veronica and Caroline have already said, is underpaid. It has precarious working conditions. It has very weak social protection. There is no or very little decent work in paid work. And the global care change, as Veronica also mentioned, deepen these weaknesses and precariousness of paid domestic work. The third characteristic of social organization of care that we see as a global trend is a trend to what we call marketization or commodification of care, which means the increasing participation of private sector providing care. And this has also to do with the weakness of public provision of care, which also has to do with countries going through austerity policies, with state, going back from the rights that they should be guaranteeing, and with this idea of thinking about care as a business opportunity. So that the tendency of marketization of care is global, is very deep in the health sector, for example. And we can also think about what we call the Uberization of care, this digital platform being used to, locate demand of care with supply of care. And these are risky trends because, it takes us from the idea of we have the right to care, we have the right to provide care, we have the right to receive care, to this idea that we are consumer of care, and we should rely on the market for this. And this is especially difficult or risky in our countries in the global south, where inequality is very high, because this means that many people cannot access basic care services, cannot access long-term care services, care for elderly people, care for very young children. So what do we need? And I will finish with this last comment. We need what Veronica and Caroline have already said. We need a human right to care, which means the right to receive the care we need, and everybody needs care. This idea of, this autonomous adult human being that doesn't need care does not exist, because I can think that I'm very autonomous and I don't need any care, but then when we finish this webinar, I go out to the street and I fell in the street and I break my leg, and then I'm not autonomous anymore. I need help to walk, I need help to go to the toilet. So everybody needs care, and the idea of a human right to care means the right to receive the care we need along the lifetime, but also the right to provide care. For example, fathers of newborns in many countries do not have the possibility to care if they would like to assume their care responsibility, because they don't have paternity leaves, for example. So the right to care is also part of this, the right to provide care, but also the right to decide which is the care arrangement that we prefer. Whether we want to develop many time to unpaid care work, or whether we want to provide some unpaid care work, but also to have some access to care services outside the household, so we can distribute care between the household and these other care actors. So we need the right to care. And in order for the right to care to be guaranteed, we need public policies. As my colleagues already said, we need this idea of care as a public good, of care policies as public services. We need to reclaim the state as carer. And for this, we need to reclaim the state for the people and not for profits. We need the state to guarantee people's rights and not to open business opportunity for enterprises. And for all this, and I will finish here, we need tax policies. We need resources to finance these public policies. And for this to also contribute to reduce inequality, we need these tax policies to be progressive policies. We need to tax the rich, we need to tax corporations, we need to tax the digital economy, we need to tax the platform economy, we need to tax those that get richer during the pandemic. This is tax justice. This is to get more resources from those who can contribute the most to finance care policies that are key to redistribute care responsibility, not only between women and men, but also between household, the state, the community, and the market. Thank you.
Thank you so much, Kvinna, for this very rich presentation. And I think the speakers so far covered a lot of aspects of the question of care, and now we will move to the MENA region with Aziza, who will present to us the work of her organization, CRTDA, but also other organizations in the region on care work. Aziza, the floor is yours.
Thank you. Thank you very much. Well, I'd rather share my slide to myself, but maybe I can share it. Yeah, I'll share the slide right here. It's essentially, I think the framing of this whole webinar is very, very useful because it allows to also to frame this whole presentation. This focus is on unpaid care work, but let me first introduce CRTDA. CRTDA is a feminist NGO that is based in Lebanon, and it works in Lebanon and in MENA region. It's been established since 2000. CRTDA goal is to achieve social justice through gender equality. So this is entrenched in our values. Areas of work involve gender inclusive citizenship with a focus on nationality rights, economic rights, and political rights. And our work streams involve knowledge generation and management. So we do research and we collect information and process it in order to monitor what's happening around us. Also involves capacity building and basically relating to women empowerment and focusing on marginalized groups. In terms of training trainers and in several areas. And the advocacy part is also at the national, regional, and a global level. It is CRTDA has experience with initiating and supporting women-led rural cooperatives in Lebanon. So CRTDA, although it has, we network and we're members of several regional and international networks, but we are ingrained in our on the ground, and we value a lot this interaction between the grassroots and local level and national and regional and global. And it's really, the more we work, the more this idea is, gets more and more entrenched and focused. And as I said, we are a member of several national, regional, and international networks that engage in advocating for gender equality in as a whole along those lines that I presented. So let me see. I just want to, okay. Just want to see my own presentation. Ah. And I'm sharing my, I'm sharing this with you, I'm sorry.
You are sharing the presentation.
Yes.
If you can put it in full screen mode. If you want.
Okay, I cannot do that. Shall I stop sharing and share it again? Okay, I'll stop share it and share it again. And okay. This is it. Unpaid care work. So the focus on this presentation is on unpaid care work. Given the broad framing of my colleagues, I venture to go into the example stage. So here we are, from what I have heard and listened to very carefully and with much enthusiasm, if I may tell you, coming from the health field and training. So it's, I usually say, the health is not so bringing the care work in such a holistic configuration, I think is very, very helpful. But my focus here as CRTDA, we are focusing on the unpaid care work in this presentation, and we have ventured to do some work along those lines. And this is an example. The objective is just to highlight an example of a feminist organization working in this focusing on this particular field. From the start, in a nutshell, this presentation is about knowledge generation about care work. So, and this knowledge generation about care work includes, first of all, identifying what do we mean by care work, and what do we mean by what are the information, and how is it stated. So first of all, we have done 2 literature reviews that review the literature on care work in the region. So, and this will also be available to everyone. And we also did, and this literature review was 2016 and 2018. Also, we did a field study in 7 or 8 villages in marginalized areas of Lebanon, the central area and the southern area, and they were focus groups, and they investigated it. They were qualitative pieces of research work, and they examined the notion of unpaid care work. So the definition of care work as it appeared in the literature review of our colleague Tina Wallace is by Elson, which is care work is all the unpaid services provided within a household for its member, including care of persons, housework, and voluntary community work. So you can also see the interplay at the micro level, at the household level of the community. And I think it's, so another conclusion from the review that Tina has conducted, also that there is no clear definition and about the household and domestic care work in Lebanon. And this, I think, is this is a matter that we need to consider while we are conducting all. Estimations are great, but the more valid the estimates are, the more concrete they are entrenched, I think the more powerful the word, and the more powerful the advocacy, and the more powerful the more the chances of getting. So there are, for example, here is an example of a definition of the unpaid care work. Unpaid individual performing the activity is not remunerated care. The activity provides what is necessary for the health, well-being, maintenance, and protection. The activity and the work is the activity involves mental or physical effort and is costly in time, in terms of time resources. So this would complement the previous presentation that essentially focus at the macro level. At least this is an attempt to share with you some of the thoughts of the colleagues who have done research on that. Also, we have the challenges, as also stated, we have challenges of the availability of statistical data in our region, and also the measurement is unsystematic, and this is also something to consider. And also regarding the quantitative work, also there are few time use studies and in the region. So again, this is the recent literature review or relatively recent in 2018. And this is one example, citation of a time study in Egypt. And essentially in the MENA region, although the hypothesis is that women are greatly involved in unpaid care work. Care work is an invisible issue. And Tina expresses, she says, this is surprising because women in this region are far less likely to work in the formal or informal paid sector of the economy than any other region in the world. And much of their time is spent in and around the home or unpaid care work. And that actually validates our the rationale, the raison d'etre of this whole presentation, the focus of this whole presentation, the relevance of the micro or the unpaid care work at the household level, at community level in the MENA region. Also, Yara Trabulsi and Lena Abu Habib. Lena Abu Habib is our founder, CRTDA founder, and she's of course a feminist. And a recent work with Yara Trabulsi, they underscored the patriarchal and exploitative capitalist assumptions and that render care work invisible. So so this is also important to accumulate, to have to have ongoing information and ongoing, not ongoing framing, but to have an accumulation of framing and to share and echo the global understanding of this issue. And also in their paper, Yara and Lena approached the topic of unpaid care work as a response to COVID-19 and underscoring the importance of unpaid care work and care work at large. They followed the Drusilla Parker and Susan Feiner school to extend our views of, and I'm quoting here, of economic activities beyond the formal market and into the household, and to consider that these activities have parallels and repercussions in the market. I thought this would this particular quote would be relevant to this discussion, given its conceptual link between the micro and the macro. Also, this is a feminist framing, and those quotes, I think also I'm presenting them to you as useful also for further reflection. For example, women do critical work both within and outside the home. This is this is part of the given, and in our view, talking women as an analytical category should not obscure dynamics that pertain to other social identification. And this is, again, this is echoing a broader and more and a global voice and the global statement, feminist statement. So class, ethnicity, sexual orientation, gender identity, nationality, and others. And also, that last one pertains a lot to our region. We also understand that women's significant contribution to their economies is eclipsed by the injustices that accompany this work, from abuse to devaluation, the process of invisibilization that renders this work non-work, be it paid or unpaid. I think also this is an interesting and quotation to reflect us. And I think, sorry, these are. So basically, let's go to the field research, the women household work. This is field research, as I told you, it's done by our colleague Claude Bustani Hajjar, and she's an anthropologist. And she did that study on 8 villages in marginalized villages. Again, despite the you know, they are different, and we in Lebanon, we are an old culture, so there are nuances wherever you go. The north is different from the south, so or Beirut or Beqa. However, despite that, there have shown similarities. In the participants in those focus group have shown similarities in the presentation of their workloads, their duties, their responsibilities, the mechanisms they put in place to cope with, as well as their general aspirations and desire to see change for their children. Again, I present that to you for reflection. Again, this also shows a commonality among global commonality among women. So the findings here again continue. Women's contribution to household economy through domestic and care work in the villages is quite considerable. So the savings part is taken, and then one interesting finding is that women recognize the social value of this work. Women are not passive workers. So this is, I think, also a very important message from the field, from the women themselves. And we are aware of what's going on, and we're doing it on our own. We know what we are doing. We're still doing it, but we need to change. So again, another finding, again, Claude also underscored the invisibility. So again, this is evidence, but he formalized it as a finding of the study. So just to wrap it up, hopefully, some ideas. Okay, in congruence with what was said before, we need to make visible. We need to make visible the unpaid work of the women. This is intuitive, I know, but it needs to be stated formally in a formal presentation through increase in qualitative and quantitative knowledge. So this is the research part. Community-based studies, standardized time-use studies. Again, we need to the production of knowledge need to be like that. And then, of course, the funding. And here is, so we are here talking at the level of knowledge generation in this, and it's complementing the broader view of this webinar. And so without one conclusion, at least preliminary conclusion from those sporadic mosaic of quotation is the need for more knowledge. We really need concrete knowledge that can be used powerfully to push for change. And one idea, again, to the feminist movement at large. Now, to what extent is care work defined here, as defined here, the unpaid care work? And this question is for the MENA region, especially. To what is it? To what extent it is a priority in the feminist agenda in general? Okay, recognizing the social organization, and I think this is a great development in the visual and the conceptualization of this care economy, care work, etc. And this is very helpful for the young activists to study and reflect upon and discuss wherever they are. But we need to know what are. Is it a priority? To what extent are we willing as a feminist movement to invest in this particular part of the unpaid care work at the household level and the community level? What are the facilitating factors that help us, that push us forward. I think most of what is said in the previously by my colleague, I would consider also as a facilitating factor that would push the movement forward. But also we need to look also at the barrier, some of which were articulated indirectly, but I think further discussion, further reflection is needed. Thank you for your consideration.
Thank you so much, Aziza, for this very dense, both theoretical and practical presentation on care work in the MENA region. And I think you asked very, very interesting and important questions for the feminist movement in the region regarding the care work. I first of all would like to thank Veronica for sharing the care manifesto in the chat box. Please check the link and sign it if you would like. I will reshare it again in the chat box. And please do not hesitate to ask your questions in the Q&A box. From all the presentations that we heard so far, I have so many questions to ask. And I think it is important, as Kvinna mentioned, the methodologies used to calculate the women's contribution into the GDP, and then Aziza mentioned the time use studies. I would like to ask for inspiration to the people from attending here from the Tunisian feminist movement and the MENA feminist movement. What are the methodologies used to calculate women's contribution into the GDP? Who would like to answer this question? Okay, Kvinna, please go ahead.
Thank you. There are different methodologies, but the one that is most used is built on the data that is collected through time use surveys. As I said in the presentation, with time use surveys, you can know how much time people allocate to unpaid care work. So you have the quantity, and then you need to choose a price for that quantity. How much money does this amount of time cost? And then you have different methodologies. You can decide that unpaid care work costs the money that you should pay if you buy for it. And then what you look at is usually the average wage of paid care workers. And you have this data on the labor force surveys usually. The other alternative is to think that the cost of the unpaid care work is not what you should pay for it, but instead what you are prevented to earn because you are not in the labor market, but you are allocating your time to the unpaid care work. In this second alternative, that usually is understood as the cost of opportunity of doing unpaid care work, then your unpaid care work should be valued with a reference that has to do with the money that you would earn if you enter the labor market. For example, in my case, I'm an economist with high level of education, 50 years old, white. So I go to the labor force survey and look some people who are similar to me, how much money they earn in the labor market, and that is the reference that I take. And most of the estimations that have been made by countries use the first alternative, the idea of the market cost of care work. And this has a problem because paid care work usually is underpaid. Domestic workers have very low wages, long-term care at households are very bad paid. So the estimations that we know are in a way undervalued. So when we say unpaid care work contributes 20% of the GDP, that is the result of multiplying the amount of hours by the average wage of paid workers, then we are undervalued because the reference of the wage that we take is a low wage. So these are the methodologies that many countries have applied that, and I can share some links in the chat if you want to go deeper on this.
Yes, please, Kvinna, and thank you very, very much for this. I have a second question. We've seen with Aziza and all the presentations that the question of care is global, but there are a lot of differences in the way that civil society, the states, and the capitalist system tackles the issue. And thank you so much for the Global Alliance for Tax Justice for putting us in touch and having you here as guests. And I would like to ask either Kvinna or Veronica or Caroline if they would like to tell us about some campaigns that had some positive impact on the way the public and the state perceives care work and the way it takes it more seriously as a public good.
Yes, Sama, I will like to share our work in Chile. You know that Chile is now discussing a new constitution, and in that discussion, the feminist movement and jointly with the trade union movement and our women's committee there are pressing and lobbying for really recognizing the human right to care into the new Chilean constitution. And I think that this really highlights the work that we could do around the world. We think that currently in Latin America, we have lots of opportunities in which the movement could lobby for really the recognition of the human right to care, but also the reorganization of the social organization of care. So we think that there we have these opportunities. We are also doing some research on specific cases. Maybe Kvinna could also develop more on that. But the trade union movement and the feminist movement, the tax justice movement, we are really working together to put this in the international agenda, not only in the governmental agenda, but also in the social movements agenda. And we think that that is key.
I don't know if Kvinna would like to add something to this.
I would like to support what Veronica is saying. I think it's key. The agendas coming together, the feminist agenda with the trade union agenda. And I can bring the example of Argentina, where the feminist movement have gained a lot of power during the last years. We even get the right to legal abortion last year because of the fight of the feminist movement. And I think something that it is also very key is to get feminists into government. Now in Argentina, we are seeing the beginning of the building of a national care system, and that has to do with the feminist movement pushing this agenda, but also with some feminists taking over in the government and occupying key positions where this agenda can really be concretized through public policy. So that is something that I would like also to add.
Sama, I would also like to add that the ongoing campaign on Make Taxes Work for Women is a campaign that brings together the women's rights movement and the tax justice movement. And one of our longstanding demand is for governments to recognize care, both paid, underpaid, and unpaid care. under the 5 R's framework. So that is one demand that we continually put out there amongst other demands within reforming the international financial architecture, because with the reforms of the international financial architecture, we will see governments putting in place more transformative tax and fiscal policies that at the end of the day would ensure governments have adequate resources to really finance care service provision, to provide other public services in education, in health, that would really go a long way to improve the position of women in the society. So the Make Taxes Work for Women campaign is one that I would also talk about in responding to your question.
Thank you so much, Caroline. I would like to ask you, when we will be wrapping up later, if you could share with us the opportunities during the year to engage in campaigns with Make Taxes Work for Women, if you would like to do so. I will give the floor to Madame Souad Riki, who raised her hand. Madame Souad Riki is Feminist Economics from Tunisia, and I will ask her which language she would like to speak in. Otherwise, for the panelists, you can choose the English channel to listen to the question. Madame Souad, تجد تحكي بقى. Madame Souad? Okay. I think she is not here now. Maybe she will come back later. We have some questions in the chat box. We have a first question in Arabic, so please go to the English channel to listen to it in English. I will read it out in Arabic. The comment/question is from Madame Emel Arbawi, who says, ضرورة إعادة النظر في السياسات الجبائية خاصة في بلدان الشمال الغربي والشرق الأوسطي. هذه المجتمعات الذكورية بامتياز والتي لا تعتبر الخدمات التي تقدم للنساء من الأولويات. بالتالي كلما تكون موارد الدولة ضعيفة لا تؤخذ الخدمات التي تقدم للنساء بعين الاعتبار. لذلك من المهم اليوم أن نربط السياسات الجبائية العاجلة بتطوير الخدمات التي تقدم للنساء، بتفعيل التشريعات التي لها علاقة بحقوق الإنسان الاقتصادية والثقافية والاجتماعية. فالعدالة الجبائية فلسفة السياسة المالية المبنية على العدالة ستدفع في اتجاه ميزانيات للدول بمقاربة الدور الاجتماعي. I will continue in English. Madame Emel Arbawi raises an important point between care work, fiscal justice, and gender-sensitive budgeting. And I think the ultimate goal of creating a fiscal space and fiscal justice is to implement budgets in a gender-sensitive way. If there are any comments or answer from the panelists on this.
I would like to comment on that, Sama. In the past years, PSI conducted a research study in Peru, in which we really follow 10 years of fiscal policies and income of the Peruvian government. And we saw a huge amount of tax evasion and tax elusion on that period. But as well, we saw that due to the high prices of the international prices of commodities, the Peruvian government had somehow more budget, and the Peruvian government increased the percentage of investments in the health sector. But that investments in the health sector were not gender transformative. because what they were investing in is in making in the health sector more attendance to chirurgical births. And they really stopped all the programs that they were allowing to make adolescents, teenagers not be pregnant. So this investment was put in chirurgical births, in more births by chirurgical methods, but not in preventing pregnancy. So we see that yes, you could have more amount of money, so you could increase the investment in key public services for women, especially health. But you also need that these policies have a gender transformative approach. If there is not a gender transformative approach, those budgets will not be used in a good way. So we think that yes, we need to have more budget, more public budget to increase investments in public services for women, but also that those services really have this gender transformative approach and do not reinforce inequalities.
Thank you so much, Veronica. And thank you for this answer. And I think we will tackle this more, the question of gender sensitive budgeting that can be effective more tomorrow in our webinar given by the Women's Budget Group from the UK on being a feminist economic watchdog. I will go to the next question asked by Luisa Mercado, who is from Brazil. She is doing a master's in law and she is investigating care and indirect taxation in Brazil. She says that she investigates whether, in addition to regressiveness, the consumption pattern of women is different from that of men because of the care work that women perform, and if the products consumed by women are taxed more than men's products. She would like the speakers to comment on this. Who would like to answer that?
I can add my 2 cents on that. I think I think this go in line with what Aziza was saying about the need to produce knowledge that can support our advocacy, our care agenda. So I think those kinds of research is very useful. And I look forward to getting the result of that research in Brazil and whether this is also a regional pattern. I would like to also bring the examples of some countries that have been already pushing for tax reduction on products that are consumed by women. In particular, there have been some campaigns, successful campaigns, about reducing taxation on products to care during the menstruation period. That was the example in Colombia. They pushed for that and they were successful. And for those, they have also estimated the cost of, reproduction capacity of women and how this is a cost that only women support. So going through the tax system to reduce tax burden on this kind of products is also one alternative.
So much, Corina. I will check if Madame Saad is back. Can you please unmute yourself? Madame Saad, كنت نجم تحل الميكرو متاعك كانك موجودة؟ Okay. I will go to another question by Asma Abu Muzied. who says, is there any work done targeting donors and financial institutions such as the World Bank and the IMF in relation to how their aid and conditions loans are affect negatively care in conflict areas? Who has an answer to this question? Does anyone know?
I have a comment. I have a comment. Since I belong to an area which has lots of conflict, usually in the public discourse, they address this topic by saying, that such acts are acts of leverage. So the support by those major organizations, if they are, they would leverage, so they would be included in the pressuring of government, so to speak. So I'm just talking about it in a descriptive manner. So yeah, this is one strategy that is talked about. It remains to be seen to what extent are factors that relate to the interest of the women in that particular countries play a role, and to what extent also other factors that pertain to the interest, the global interests of those organizations play a role. So this is, in my view, a complicated topic that one needs to address with caution and clarity. And that's why the emphasis on concrete knowledge is the most, a very powerful pressuring tool. All other, and the presence of support and solidarity from the feminist movement and from trade unions, from from popular organizations that represent movements on the ground, I think also needs to be considered in addition to the leverage that is assigned to such organizations. Thank you. I hope I hope it makes sense.
Thank you so much, Aziza. Now, Madame Suad is here. The floor is yours, Madame Suad, if you can speak in Arabic.
موجودة. تسمع فيا سماح؟
نسمع فيك. To the panelists, if you can switch to the English channel so you can listen.
بالفرنسي ممكن ولا بالعربية؟
بالعربية من بينا خاطر عنا
بالعربية. مرحبا بالجميع وشكرا للمحاضرات، كانت عروض شيقة. أنا بدي نقدم ملاحظتين. أولا بخصوص الدراسات حول عمل الرعاية المدفوع أو الغير مدفوع الأجر. شفت في المداخلة الأخيرة أنه في شمال أفريقيا في المغرب العربي ذكرنا مثلا المغرب ومصر. نحب نقول أنه في تونس كانت فيها أعمال رائدة بخصوص دراسات حول عمل الرعاية الغير مرئي. كان أول عمل كان نشره في دراسة قمت بها شخصيا مع الكريدي في مركز الدراسات والبحوث والتوثيق حول المرأة. كانت دراسة حول العمل الغير مأجور والغير مؤجر للنساء الريفيات حول عينة معناها ممثلة إحصائياً ل 3000 تقريبا 3000 عائلة في الريف. وتوصلت الدراسة إلى كل الاستنتاجات اللي اليوم معناها تناولناها. من أهمها أن قيمة هذا العمل هي قيمة كبيرة، وهي قيمة غير مرئية، وهي قيمة غير معتمدة في الإحصائيات الرسمية. وكان الداعي من هذه الدراسة هو الإقرار بأن مساهمة النساء الريفيات في العمل في الوسط الريفي هي قيمة تفوق مساهمة عمل الرجال، سواء كان في الفلاحة أو في الأمور الأخرى. وخاصة في عمل الرعاية يمثل أكثر، قرابة 7 و8 مرات عمل الرجل بصفة عامة. وهذه دراسة نشرت في 2000، وثم وقع تعميقها في هذا العمل، وقع تعميق التفكير وفي إطار بحث لدكتوراه دولة في عام 2005، وصار فيه تقييم عمل النساء في الريف الغير مؤجر. وكانت نسبة هذا العمل في الجي دي بي لو بي بي كانت قرابة 15 أو 16%. معناها وكان فيه هذا الرقم لقد قدم في المحاضرات اللي سمعتها، ولكن هذا في الريف فقط. ثم في عام 2005 صارت دراسة أخرى في إطار نفس المركز وبإشراف وزارة المرأة، وكانت تشمل لا فقط عمل الرعاية في الريف، ولكن الأعمال معناها داخل المنزل في الريف وفي الوسط الريفي وفي الوسط الحضري. كانت أشرفت عليها مع ثلة من الباحثين صديقة دورة محفوظ، وصدرت في 2005 ووصلت نفس الاستنتاجات. ثم صار تقييم العمل الغير مؤجر والغير مرئي والغير محسوب في الإحصائيات الرسمية. كانت قيمة عمل النساء في هذا العمل المنزلي والغير مرئي بمثابة 43% على مستوى وطني. إذا معناها فيه هذه المجهودات، ووصلنا في تونس في كذلك العديد من التدريبات، وصار فيه تحسيس، صار فيه معناها عدة تدريبات حول هذه المواضيع. نحب فقط ملاحظة ثانية حول مفهوم عمل الرعاية، ويبدو وكأن مفهوم غير محدود وغير دقيق إلا أنه نحب نقول اللي على مستوى منظومة الحسابات الوطنية، le système de comptabilité nationale لمنظمة الأمم المتحدة منذ 73 وضعت منظومة أدخلت وأدرجت إلى حد ما العديد من الأعمال الغير مأجورة، وهي أعمال رعاية داخل المحاسبات الوطنية. معناها من المفروض كل دولنا تعتمد هذه الطريقة، إلا أنه في الواقع أكثر معناها أكثر من البلدان لم تتوخى هذه الطرق. ولكن المهم في هذا كونه منظومة الأمم المتحدة le système national de comptabilité nationale وضعت مواصفات لتحديد مفهوم عمل الرعاية الغير مؤجر، وهي محددة. ولهذا معناها لنا التقنية الكافية اليوم حتى نحتسب هذا العمل. معناها أظن أنه التحديد معناها للمفهوم هو وارد، ولكن ذوي الاقتصاد واللي لهم إلمام بهذه التطورات هم الأدرى من. أظن كونه المسألة ليس متداولة وليس معناها، والدول بصفة عامة لم تعتمد هذه التقنيات لإدماج هذه النسبة من الأعمال، أي أن هناك الأعمال نوع من الأعمال المدمجة في هذا السلم، في هذه المواصفات، الأعمال لي برودوي تانجيبل كيفاش نقولوا، وليس الخدمات المنزلية نون تانجيبل. ما عرفتش كيفاش
غير الملموسة.
الملموسه، سيتادير وقت اللي تعمل جاتو، وقت اللي تخدم تريكو، حاجه ملموسه، هذيك تحتسب في المحاسبه الوطنيه حسب منظومه الامم المتحده. ولكن لما تعطي درس الابناء بنتك ولا لولدك، تعاونهم في خدمات اخرى غير ملموسه، ما زالت ما ثماش الطريقه الوحيده هي طريقه الوقت. هذيك صحيحه طريقه الوقت، ولكن باش تعطي قيمه للمنتوج ما زالت ناقصه. اللي نحب نقوله اللي هناك طريقه هي المعتمده كما قالوا صديقات وزميلات، هي الاعتماد على الوقت المخصص لهذا العمل، وهذا معناها شيء معناها في متناول الجميع، ويمكن الحصر بطريقه علميه، ويمكن اعطاه معناها نوع من الأجر، مثلا أجر معينة منزلية ينجم يعطينا نوع فكرة على العمل اللي نقوم به في المنزل معناها النساء. ثم طرق أخرى اللي مثلا وقت اللي النساء معناها تشتغل في إطار معين كطبيبة أو كأستاذة جامعية، نعتمد أجرها كطبيبة أو أجرها كأستاذة جامعية، هذه كذلك طريقة. ولكن الطريقة المتداولة واللي هي أسهل واللي قمنا بها في تونس معناها هي اعتماد على أجر معدل أجر معينة منزلية للقيام بكل أعمال الرعاية للعمل الغير مؤجر. هذه معناها بعجالة هذه الملاحظات اللي معناها حبيت نسوقها، ولكن ما فيش ممكن وقت باش نداولوا في مسائل أخرى. وأنا سعيدة جدا للتواصل مع كل صديق الزميلات اللي حضروا، نتواصلوا في هذا الموضوع في المستقبل، وشكرا.
عايشة مدام سعاد. أنا باش نكمل باللونجلي دونك تحب تحط ترجمة. Thank you so much, Mrs. Saad Triki, for all these insights on the Tunisian context and the ways the care work in the rural areas have been calculated in the past, and then about the UN calculation system into of the GDPs of the countries in the world. It is time now to end the session. It has been an amazing time that we spent with you, and we listened to so many interesting insights from South America, Lebanon, the MENA region, and now Tunisia with Madame Saad Triki. I would like to end this session with some takeaways that we probably collectively think about them. First of them is the definition of care work and how this definition can be standardized across the world, so we can work on a standardized methodologies and kind of disseminate the knowledge about care work. I would like also to quote Aziza when she asked the questions at the end of her presentation and said, what are the facilitating factors and the barriers to make care work a priority on the feminist agenda globally, on the MENA region, in the MENA region, and on the national level. I will leave you with these questions, and I will give the floor to Caroline if she would like to advertise for the campaigns that the Global Alliance for Tax Justice is involved in. Otherwise, we also have tomorrow a webinar at the same time with the Women's Budget Group on gender-sensitive budgeting, but also on the early career network that they have. So please register and attend tomorrow as well. Caroline, if you want to speak now.
Thank you, Sama. I'll leave my video off because my internet is now a bit unstable. So to respond to your question in terms of opportunities for us to engage, I think we have very many opportunities to bring our different collectives together, the different movements. More so because of the socioeconomic crisis that we are currently witnessing because of the pandemic. And it's women who are hardest hit because, of course, as we've said, they're the majority in unpaid care, in precarious work, or in low-paid domestic work. And so the need for governments to implement structural reforms that uphold redistributive justice, including equal and progressive tax reforms, really is very urgent, and of course to uphold the social organization of care. So towards this end, the Global Alliance for Tax Justice, together with the Working Group on Tax and Gender, usually holds an annual campaign moment in the month of March to coincide with the Commission on the Status of Women conference. And the campaign is usually about making tax work for women. And of course, as I said in my sharing, that one of our objectives is to ensure that governments put in place tax and fiscal policies that serve to recognize, to reduce, to remunerate, to reward, and of course, we need to reclaim care work. So it would be important for every one of us on the call to join in and be part of this campaign to continue to push governments to make these changes so that we can improve the position of women in the society. I'd also want to mention the other area of engagement would be through our working group, the Tax and Gender Working Group. If you're interested to continue having these discussions, it's a space where we meet on a monthly basis, and there's a listserv where we regularly update members on developments on the issue of tax and gender, including on the issue of care. So if you're interested, please also feel free to reach to Sama or to reach to myself, and I'll be able to provide guidance on how to join the working group. And lastly, in December, we will be holding our first ever conference on tax and gender from the 6th to the 8th of December. It will also be a space where we will be unpacking the policy issues around tax and fiscal policies, as well as those that touch on the care work that we are doing. So it's also a moment that I would invite those who are participating in this call to join us during those moments. And of course, during other campaign moments across the year, there's the Public Services Day that happens in June, where Public Services International is usually quite big on, and Veronica is here. She can maybe also talk about it. So there are several campaign moments that we can be able to participate in throughout the year, and of course continue to shape up and to frame the different struggles that we have in a joint manner. Thanks, Sama. I'll hand it back to you.
Thank you so much, Caroline, and thank you so much to the Global Alliance for Tax Justice, Thank you, Corina, Veronica, Aziza, and for your respective organizations, and thank you all for attending. And I would also like to thank Rabib, the interpreter, for her amazing work. See you tomorrow, hopefully. Otherwise, stay tuned. We still have 4 other webinars and maybe more webinars in the upcoming years. Do not hesitate to reach out to us at any time. And I wish you a lovely evening, morning, depending on where you are based. See you soon.